Welcome, Sundeep. I'm glad that you're here to report about your new company, AllesHealth. And the title of the talk is Working Towards Empowering Patients and Carers Across the World by Building a Circular Economy. So that's the last session of our XtraTracks for the GMDS 2032, 23, sorry, for the GMDS 23 meeting and conference in September as a preparation. And so we're glad to have you here. And while these sessions are about the facets of self-tracking and clearly from a patient perspective, it is good to know how this fits into the bigger picture. And your new company, AllesHealth, is definitely going towards this goal, and we are happy that you can report about it.
Thank you, Andreas, for the invitation, of course, to be part of the XtraTracks here. And what I would like to do is, of course, I would like to share a few slides with you and the group here, and obviously, pleased to answer the questions regarding AllesHealth there might be, and of course see how the conversations goes. But really pleased to be here. So let's maybe start with sort of just to kind of build on what's overview of our story as AllesHealth. Let's maybe just sort of look at a couple of problem statements that we are really trying to address here. So we look at overall lack of patients' engagement and empowerment, which results in an inferior healthcare system. So there are about 78 to 88% of the genomic database is European, which drives quite a large amount of inequalities in further drug development, which are genomic-led. 60% of global population is Asian, with only 11% global trial participants are Asian. 80% of clinical trials fail to meet enrollment timelines. 65% of Black people have experienced prejudice from healthcare staff, rising to 75% between 18 to 34-year-olds. And there are many more which sort of, focuses on gender diversity or lack of gender diversity or age diversity, and also lack of data sets for real world, for rare and ultra rare diseases. This is really where AllesHealth was looking at as a problem statement. And then we also look at real world data, which is sort of largely more than just the EMR or EHRs itself. And how do we collect various EMRs that are sort of, combined from different sources itself. And that could be administrative data sets, claims data set, patient diseases, health surveys, wellness sensors data, and all sorts. So that's sort of where we kind of, started with our problem statement. Now, for just a minute or so, I would like you to imagine as a researcher who is possibly sitting in a lab for a healthcare company looking to advance on the clinical research. And whilst there are many data points available, they are lacking information that what might work for a specific ethnic group or what might work for a specific patient for that matter. So that's one side of things that what we look at from a data gap or the actionable or usable data sets. And then there is the other side when you imagine a carer who's sitting in potentially Colombia or Brazil, and they are caring for their parents, their aging parents, who have gone through the healthcare system and going through their own engagements within the healthcare ecosystem and generating quite a lot of large amount of data sets itself, and those are real world data. Now, this is where AllesHealth comes in, is how do we combine that together, and not only we bring those two, one who has the real world data set from varying population, but also the one who has a need within clinical research. And how do we do that in a compliant manner? How do we do that in a secured manner? How do we do that that benefits patients at the end, because they are the ultimate owners of their health records? And this is where really where AllesHealth comes in. So we are building, as we call it, the most inclusive clinical insights platform that ensures diversity in clinical trials, that prioritize patient centricity, and rewards patients and carers within the healthcare ecosystem through health rewards. And of course, our core components are built on some of the advanced technologies out there that our team has been able to put together. Just a brief overview about AllesHealth. It's a Switzerland-based health tech company. I myself have spent quite a few years at Roche prior to starting AllesHealth. We are focused on to empower patients and carers. We also provide medical records library and where they can better manage their family's health. And it generates health rewards for patients for offering free or low-cost health services. And that's where we are focusing on building partnerships with labs and hospitals in individual markets itself. We have been recognized by a few of the organizations around the globe as top 10 in the world for blockchain startups to be watched out for, and so on. We are very pleased to be part of the Digital Health in Basel. That's a booster, a local booster in Basel, and many others, which are efforts to make clinical trials very inclusive has been recognized, and we are very pleased with that, humbled with that, and we take that we take that responsibility very seriously. Our mission continues to be to unlock real-world data and empower patients and carers, and we do that through our AllesHealth app and AllesHealth Real World East platform, which I'll touch upon in a few seconds. So this is where we kind of come in terms of what's the role that we play in, and this is patients and carers who harness their data sets, who are the owners of their health records. We work with hospitals and labs and clinics who are usually the care providers, and healthcare companies and CROs and multiple other stakeholders who are usually the consumers of those health records, anonymous health records. Is how do we combine that together? And that's where really the circular economy starts to take shape. AllesHealth has two solutions. One of them is already live, B2C, AllesHealth app that is already live in our low mid-income markets, starting with India, and the others are being followed. And we are working on our B2B solution that would be targeted towards healthcare companies and CROs and anybody who is interested to leverage health records or anonymous health data for clinical research. We have a multi-stakeholder approach in which we look at the benefits for patients and for healthcare companies as well. As a patient, you would always have your records digitally available, offering complete health journey and better care options. We are also including components that focuses on preventive and predictive care. And this is built on our own clinical research teams, predictions and assessments of real world data that we would incorporate over a period of time, and healthcare data monetization elements, which offers health rewards for patients and carers. As far as real world ease is concerned, that's where we would be able to offer a large database of structured real world evidence, which is anonymized, de-identified real world data with patient consent. And our benefits are very much focused towards building a real world records library for CROs and healthcare companies, building digital companions for patients, and providing patient journey mapping for hospitals and clinics as well. So these are some of the core focus points in terms of what benefits that it provides for CROs and healthcare companies. Some of the questions that I get usually is, why would somebody partner with AllesHealth? And this is sort of where we kind of come in, that our focus is that we bring a large amount of patients who are disease agnostics, and they have the ability to store their records, their clinical engagements within a platform. And this is the platform that we offer for as service offerings for many healthcare service providers. So it's basically a shift that we are looking that empowers patients. Whilst today the care providers are on many levels at the driving seat, this comes more patient-centric care. So, for example, if there is somebody who is providing a home-based EKG kit for cardiac patient, we are able to offer those only to the ones who are possibly a patient of a within cardiology or in a risk category of cardiology based on their family's health. And this is targeted offerings towards that patient groups itself. Similarly, for labs, which are currently offering their tests on quite a large amount of referral fees, that can bring the cost down for patients directly by offering those products which are required by the patients themselves, and so on. So it also includes telehealth services, merchandise offerings. So anybody who's basically offering services for patients, they're able to do that directly. How that looks like at the end, it could be discounted offers for what patients are requiring. It could be free offering for a body checkup or an early screening. It could also be family insurance when you have entire information about your family's health. It can be targeted products which can be built, ensuring obviously we partner with companies who are providing ethical products towards patients, and certainly some other benefits which are day-to-day use, like some electronics, AirPods, Apple Watches, those kind of things that helps in better care for patients as well in their day-to-day life. I'll probably take a pause here just with this, and I'm very happy to answer questions. We also get many times, will there be a change? Will clinics adopt? So I constantly come in with regards to, while AI may not replace clinicians, patients will readily discard clinicians who fail to leverage technology for enhanced engagements. And this is sort of a shift that we are seeing specifically coming from a patient centricity, where a lot of countries, for that matter, are making huge strides in terms of how care is delivered, how care should be delivered for patients, and that is patient-centric. I'll take a pause here, and of course, our team is small but growing, and we are happy to answer any questions that you might have at this stage.
Thank you very much, Sundeep. So maybe I start with the first question. I mean, obviously you said your app, so for the patient, is out in India now. And how does it work? I mean, let's say I'm an Indian patient now. I'm pleased to see that you provide this service. I download the app, and I'm scanning first my whole paper stuff in, or maybe have some electronic records already available from some DVDs, whatever means which I have from my doctors, right? And then I start using the app, right? Is that how it works, or do I get something wrong?
Largely, yes. So you're able to get the AllesHealth app from your Apple or Google stores, and you're able to build your family tree. It's unfortunate I can't actually. I would love to demo it here, but I think WebEx have certain limitations. I'm not sure if I can do that on the phone, but maybe for one of the future sessions we probably would do that. Patients are able to add their family's information, and as far as clinical records are concerned, you're able to certainly store all your clinical records in multiple markets where we are seeing records aren't really stored on DVDs these days, especially in sort of, some of the markets where phone usage is quite high, and patients receive a lot of their reports coming through either WhatsApp or through emails. So they're able to store that, or they take images of their physical, hard records, and just store it as they would normally do, like I think we do back in Switzerland, where we are able to sort of take pictures and send it to our insurance company. So pretty much in a similar way. So anything that we can think of is possible as far as taking the images or physical records is concerned. What patients also are able to see is once they bring their health records, it structures it in a way that is consumable for them. I mean, today, if I see my health record, it can be very, very daunting, even though we work for healthcare companies itself. So we make it, usable in a easier manner. And also it offers them clinical insights, which isn't common for patients to receive after they move out of the doctor's office. So they get certain updates, they get certain information which can benefit them to better manage their health. And that's what we are certainly targeting for, to bring more and more features within the product itself that helps patients in better health management. And as I mentioned, sort of clinical insights is certainly one of our future goals, to add more based on assessment of their real world data itself, to offer them better insights for day-to-day health management of the family.
Okay, and that means for, let's say, the more Windows part you presented in your slides, that is for the care providers. So they then obviously can look at the data, or maybe copy that into their health, their hospital information system, if they want to have that. Is that how it works?
So
kind of you're really the platform in between, because I mean all this. I mean, maybe you're targeting it in countries where also the healthcare providers don't have too many systems, right? Then of course it would fit that they use your system.
So what we are looking at is it's patients are able to decide what they would like to do with their health data. That's sort of at a primary level, where it's the onus and the ultimate ownership remains with the patients themselves. So if they would like to share with a clinician, they are able to share that through digital records that they would like to. Of course, we would offer integration capabilities with many different lab management softwares out there, and also hospital management softwares out there. So we integrate with them in future to offer seamless integration for patients to be able to share their records. Today, it's done through emails or through other channels to get second opinions, and to also consult an additional doctor, so they don't have to carry these huge amount of paper with them. So it's a different setting, but all of that is, or most part of that is digitally driven in any case. So it's not like, I mean, I hardly see in our initial patients, I hardly see anyone taking pictures, because a lot of their reports are well documented PDFs, which is not the case that even in Switzerland. What we get today there is we get at times a PDF or still a USB stick to get our clinical records. So I see quite a bit of an advancement in that space, and that makes it easier for us to, I wouldn't say easier, for us to read through those reports and offer clinical insights for patients. But we would not, the responsibility of sharing that data remains with the patients. It's not something that we would do with hospitals or clinics directly. It's something that patients are able to offer and provide that information to their care providers.
Okay, very interesting. And I guess because of the kind of the methodology you just mentioned, I mean, these XtraTracks are more or less dedicated, of course, also to the let's say to the insights people get because they do their self-measuring stuff, right? So they have their Apple Watches, as you also pointed out, some devices. So they are, let's say, they're caring about their health. They are somehow collecting data about themselves, right? Which of course is also interesting for them and also in some cases for the healthcare providers they are supported by. So I think with what you just said for AllesHealth, it's no problem, of course. I mean, if you use your gadgets, right, to gather certain data, or if you, let's say, measure certain things for yourself, even if it's not coming from a gadget, because you report about yourself, about headaches, about all this stuff which no gadget can measure easily for you, but you know yourself whether you're feeling well or not, right? That can be included easily into the equation, I guess, of your AllesHealth data, right?
Yeah,
Because,
so I mean, yeah, we have to differentiate. I mean, there's multiple data points itself, and we should be, careful in terms of how we are taking that into account. And whilst each one of those elements are longitudinal data is quite beneficial for clinical research itself. So where we look at it, I mean, there's certainly a clinical records that that patients have, that as I touched upon earlier, the EMRs, the lab reports, the imaging data, and the prescription information from the care providers to the patients. There's also these wearables that comes in that offers behavioral data points as well, in terms of what kind of movements you have on daily basis, what kind of sleep patterns you have, and so on and so forth. And also there is large amount of sort of psychological data points as well, which you could potentially add whilst you are playing certain, or how you're interacting with the solution. So we are I wouldn't claim that AllesHealth has capabilities to do all of that today. It's something that we have on our roadmap, because we focus patient as a complete as an overall as an overall human, I should say, which sort of produces multiple data points that needs an analysis. And that's sort of what AllesHealth is able to bring to a greater degree. At least today, we do to certain elements of that to that data, but we would in future would like to bring that together for other elements as well.
okay, very good. Any other questions from the?
It's Benoit here. Just maybe two questions. So, patient get control of everything and they share the data, but I mean, as a patient, how should I trust AllesHealth? That they will do what they promise, that my data will not be misused and my name will be, I don't know, my health condition might be misused somehow, by insurance, bank, whatever.
Yeah. Benoit, you touch on a very important point, especially sort of, anyone who is trying to enter this market, or any market for that matter. There is, especially when it comes to health data, we are, as individuals, we are quite sensitive about it, and rightly so. In a way, it's not necessarily that we would say that we have sort of cracked the code in a way. We are, we continue to work on, what we offer to our patients. But what we do, and this is what, no other companies can claim, is the consent remains with the patients themselves. So, or how we are doing it is certainly in a much more easier manner for patients to be able to make sure that their health records are secured, are anonymous. What we can provide is a simple, we provide a lot of transparency. We provide, clarity in terms of how their health records are stored. And this is also something that gets built over time. It doesn't sort of happen on day one itself. That's one element. And, we are also partnering with a lot of patient groups and labs and doctors, care providers, who are trusted partners for care providers usually. So that's where for us as AllesHealth, we are certainly interested to be much more stronger player. But it is there's no silver bullet to trust. What we are certainly doing is we are being very transparent. We have taken all measures that are and even more that are possible to ensure compliance and data security and privacy. And in any market we would launch, we would certainly follow all the local regulations to ensure compliance with those as well. So that's sort of why it takes so much time to build a platform that patients are able to trust and also are able to control, because that's what they get when they come on AllesHealth.
Thank you. And maybe a second question, maybe a bit related as well, is about the financing model. So I guess patient will not pay or little, then hospital probably will not pay. So I guess it's only the data users who would pay probably. Is that correct? Or ultimately in the model, I mean, talking about, 5 years from now or something,
Yeah. So, I mean, there are, different markets would have different models altogether. So it's not as simple as that we could just say patients will not pay, or hospitals won't pay, or healthcare companies would be the ones paying. Our focus remains on offering almost free or freemium services towards our patients, and ensure that they get the clinical insights that are required for them. But certainly how we support the clinical trials, how we support clinical research advancements, that's where we feel that this real world data, anonymized real world data, can potentially add huge amount of value. And that's where obviously the business model functions, but it works different from market to market. And depending on what triggers in different markets, we would adopt the right manner of service model itself.
Are you following up in EHDS, European Health Data Space, or something? You know about European Health Data Space? I mean, they do something similar like this. Or are you kind of following up what's going on there?
I am. If you want to elaborate more, I can probably give you 2 cents from my side. But yeah, I know there are a lot of exciting things happening. I mean, this is great to see, being in the industry, right? There are a lot of partnerships happening in this space as well, and we'd love to obviously see how we can contribute to that.
Okay, thank you.
Okay, so I have a question. I just had a look at my app store. So from the German perspective, I think I cannot access the app. Or how could I play around a little bit, have a look as a German patient? So I think that would be interesting for our audience who have a look at the recording as well.
Yeah. All I have to say is please wait. It's coming soon in Germany. So
Okay, great.
once it's ready, we want to make sure we launch it and it's compliant with all the German regulations as well before we launch. And that's what will take some time before we launch it in Germany. As I started my introduction, our focus from a B2C perspective remains on low mid-income markets, which is a major gap in terms of clinical research for B2C populations itself. So we work directly with patients and carers in those markets itself. And initially, we have launched in India. We are following up with South Africa, Nigeria, Brazil, Indonesia, and Philippines, these being the 6 first markets for us. Whilst our B2B, which is our targeted real-world ease platform, is what we would launch in Switzerland next year in Q2.
Okay, interesting. So just one quick question. Why did you focus on blockchain? Is it just the buzzword, or so? What were your reason, your rationale behind this?
Yeah, no, from a technology perspective, I mean, we identified blockchain offers us, great possibilities. I feel, for especially, so first, maybe AllesHealth related. So for AllesHealth, we are leveraging blockchain capabilities specifically for consent management. It offers us, much more stronger ways of managing consent, also making sure that there is anonymization possibilities for leveraging our own blockchain itself. From the industry perspective, I actually see blockchain as a great way to address the lack of trust issue that the question was asked earlier. And I feel, blockchain needs healthcare as much as healthcare needs blockchain to certainly, build certain major use cases. So I'm a big supporter of what capabilities the technology can bring for us. Tangibly, at AllesHealth, we are able to incorporate that within our consent management, and we have many other possibilities in the future which we'd like to bring in, leveraging the blockchain capabilities itself.
Sundeep, you mentioned the kind of local regulations, which we all know are different in each country or region. Is it difficult to find out about that? I mean, we all assume everybody knows everything, which is quite difficult because the countries and the regions are so extremely different, right? So I think that's, I can imagine that this is to find out about it, right? I mean, you have to have experts at hand, I guess. Or how do you gather this knowledge, let's say,
Yeah.
right?
Yeah. I think when you want to make a change like this, it does take quite a bit, but it's certainly not easy, Andreas. You've worked in compliance as well for many years, and you
That's why I'm
recognize
asking.
this.
That's why I'm
Right? So
asking.
it's certainly not an easy task, and that's why we can't be rushing into things for country launches. Whilst we recognize what we are offering would benefit patients across the world, could potentially offer a lot of capabilities around the world. It's something that we are being very mindful of. And we do spend quite a lot of time with our local partners. We do spend quite considerable amount of time, reading through, working with companies who have done that in the past, and that sort of, as staging goes, helps us to to understand more. So for example, we are, whilst we are following obviously all the local guidelines in our first market in India, we are also currently working with a local partner to integrate into government's digitalization mission, so that AllesHealth can be integrated with what the government in India is doing. And similarly, different markets offers different challenges which we have to address from not just from a business perspective, not just from from perspective of how would we actually bring the patients. We also have to address it from a compliance and regulatory manner as well. And that's what we want to make sure that we take the time and we go as the pace dictates us to ensure that we also have all the necessary approvals that we need.
Sundeep,
Great.
thank you very much for sharing these insights and the beginning of your journey with us, because I mean, we just have to remind that I think your company was just founded beginning of the year, right? And we have
Correct,
August
yes.
now. So it's just a little bit more than half a year. And the first app is out. That's definitely not bad, I would say, right? And thank you for sharing. And
Yeah.
we wish you every success you can have. So that's, I think it's a very interesting approach, definitely. Because a lot of solutions we see are targeted for small things, small enhancements to do something better in maybe some broken healthcare system, right? Or to, but I think this approach is like kind of overspanning, and this makes it so fascinating, I have to say. Right.
Thank you.
Good.
Pleasure to share this with you guys. Thanks a lot.